Hi, and good morning, and welcome to everyone. Thank you for joining us for today's webinar. My name is Dawn Lane, and I am the Program and Implementation Manager for the Massey Learning Institute. Today's topic is healthy mouth, body, and mind, the key ingredients for a healthier lifestyle. So I was reading an article from the World Dental Federation, which stated that the mouth is the mirror to the body. Wow. And that the mouth cannot be considered in isolation from the rest of the body, as it offers clues about the status of our overall health. So the article went on to say that there are over 3.9 billion people worldwide affected by oral care diseases. And when they are associated with a number of non-communicable diseases, such as diabetes, cardiovascular disease, respiratory disease, just to name a few, that could be devastating, and we really, really, really need to pay attention. Okay, but before I get ahead of myself, we have the expert here today. Our presenter is Dr. I'm going to try to say his name, Baqin. But he told me I could call him Dr. George, as all of his patients call him Dr. George. I hope he does say his name as he begins the session so that we are fully aware and we know his correct name. So Dr. George has been practicing dentistry since about 2012. And throughout his academic career, he has acquired technical experience and skills in general dentistry, and advanced training in surgical and endodontics. He's worked in the public sector at UWI, and he's managed multiple dental clinics on the beautiful Twin Islands of Trinidad and Tobago. His main objective is to offer safe, reliable, and cost-effective dental care to all of his patients. But before I hand you over to Dr. George, just a little reminder for today. If you have any questions or comments during the presentation, please type them in the question and answer box. We will have a Q&A segment at the end of the presentation so that as many of you who want to post questions and we can respond to as many as we can, that would help. If someone posts a question that you wanted to ask, simply click the thumbs up icon next to that question, and this would help us in further selecting questions that you are keen to have answered. So, without any further ado, it is my pleasure to introduce you to today's presenter, Dr. George. Welcome, Doctor.
Thank you so much, Dawn. I hope everybody can hear me out there. And I wanted to thank the Massey Learning Institute for having me and for everybody out there taking the time to really participate in this webinar. So just like Dawn said, we're going to be dealing with oral health and its effects on the overall health of an individual and looking at quality of life for that individual. Moving forward, let's look at our topics today. Our topics are going to be about what is oral disease? Where does it stem from? And what are some of the causes and effects and symptoms that are related to oral disease? Then we're going to look at the limitations and barriers that affect an individual, like myself, like yourself, from receiving dental treatment. The two extremes of dentistry, whether it's be pain or cosmetic treatment. And then we've been dealing with COVID-19 for 2 years now, and it's had an effect on us individually, as a population, globally. So we're going to look at those effects. And then understanding our responsibility to making sure we receive proper oral health. And then I'm going to give a little bit of some ingredients that maybe can push you towards having good oral hygiene and good oral health as well. So what is oral disease? We all know it as cavities, gum disease, broken teeth, sensitivity, and at times oral cancer. We have to understand that there is a cause to these because these are the symptoms. But the cause comes with some reasoning of why we didn't probably take care of our teeth, whether it's their diet or oral hygiene. There are some limitations, some things that can affect us from reaching out or doing proper oral hygiene. So before we get into that, we have to ask questions. We have to, as a dental community, we have to ask people, is dental health important to you? Is visiting a dentist important to you? Is having a nice smile important to you? And everybody that you would talk to would say, yes, I love going to the dentist. It's part of my important 5 times a day and floss my teeth all the time. But when we ask another question, are you going to visit your dentist? Most people will say, yeah, 2/3 of them. But 1/3 will actually go to the dentist. So we have to sit back, think, what is the reason for it? Where are these limitations that are preventing from an individual from visiting their dentist, going to their dentist, and looking after their oral health? I feel like these are an important factor. And the first one is cost. Everybody will tend to say cost deals with money. And yes, dentistry sometimes can hit the pocket very hard. But cost can be multiple things. It can be physiological, it can be psychological, it can be emotional, it can be anxiety, it can be fear, it can be biological. Just taking the time and energy to visit a dentist is costly to a patient. So we have to understand that limitation and figure out how are we going to address it. Family experiences and cultures, such an important part of why people don't go to the dentist. You know, we all have that one person in our family that will say, going to the dentist, why are you doing that? You know, I've had this terrible experience with this one dentist. All they care about is money. Or every time you go, it's pain. So that negative perception can trickle down to your kids, other people in that community. They can change that perception of oral health in an entire population. And then it can lead to that lack of interest. That lack of interest. Are you guys still seeing? 1 second, please. I don't know. That, here we go. There we go. Sorry about that. Technical difficulties as we sometimes have. So it leads to that lack of interest towards dental care. And then we look at another limitation, education. You know, Peppa Pig is a wonderful example for education to a younger generation, but it's not enough. You know, there's a lot of education out there for medical services or medical conditions such as diabetes or cardiac problems, sleep apnea, multiple conditions. However, there's not enough education for dental care, oral health, and its connection to overall health in one being. So, because of that, we tend to have two extremes of dentistry, what I've seen. One is pain. We go to the dentist because we have a pain in the tooth. But a lot of times we don't realize that when that pain is there, it's most likely too late for the standard or the proper treatment. A lot of times we tend to get to that high cost treatment like root canals or crowns or replacement because of extraction. And then the other extreme is the Hollywood smile. So sometimes people just go because of that cosmetic look that they're looking for. But let's start with pain. What's the reason behind it? When I first started my career, a lot of people would come in just for discomfort, just for pain. And it's good to treat patients, it's good to treat you. However, we have to start asking questions, what's the reason for that? Why did you wait so long? And it comes down to these three things: cost. Money is such an important factor of receiving dental treatment. And we all know at times it can be expensive to visit the dentist. And sometimes just from not knowing how much is going to cost, that fear of not wanting to go there and get all that information of how much it's going to cost you, how much time it's going to take to deal with this treatment. So, excuse me, these three factors are a big deal to preventing somebody from getting the timely treatment and end up having to be in pain and having an infection that leads to missing out on life. But does this, where does oral disease impact you as an individual? So I tend to look at it from a physical aspect. When we sit every day and we look ourselves in the mirror, we're trying to see that nice smile. We're trying to see where that change can be. But I take physical to a little bit further. For example, you are going out with your friends and you want to eat a meal. If you have missing teeth or an ill-filling denture, or you don't like how your smile is looking, it can affect how you eat, how you deal in that scenario. So that physical aspect of it goes further than just what you see or what another person sees. And then we look at the social limitation. We know in Trinidad, we love to line. Every day can be a line, Friday to Friday, every day. So if there is a limitation, if we're in pain and we can't go out, that can prevent us from having that social networking. It can prevent us from applying for a job or doing an interview to the best that we can, because the interviewer might look at you and say, you know what, they have a few missing teeth. What's that about? Is there a problem there? Or it can affect you from missing school. So that social limitation is a big impact on your quality of life. And then emotional. Being self-conscious is a big factor of seeking dental treatment. A lot of clients would come to me and the first thing would be, doc, I don't want you to look inside. I'm afraid of what you're going to see and what you're going to say. So that emotional part of it is such a big deal of not wanting to receive dental treatment. And it will affect you overall in well-being. And then we look at today. Where are we today? Um, how does this affect us? How does this trickle down, all these limitations? And I believe it trickles down to people around us, the younger generation, our kids, our nephews, our younger brothers, our younger sisters. We have to understand that our limitations can become their limitations. Our routines of how we do things, our perception of dental care can become theirs. They can have that negative perception of oral health. It can affect them long term, that they look at it as not an important part of their overall health. And it can continue and continue to the next generation and next generation. So, us as a dental community have to break that cycle. So, we have to look at ways to be able to help. And the ways that we can look at it is the problems that we dealt with is cost. There's a lot of dentists in my clinic. We look at, a treatment, overall treatment, and then we look at a payment plan. But what we really have to focus on is prevention. If we look at a patient that has been seeing me for years and they're doing their yearly cleanings, they're doing their proper oral health at home, they're taking care of their teeth, they're flossing and brushing timely, prevention becomes less of a hit on the pocket. It's still a cost. It's still expensive to a means, but it's still less than if you go to the dentist once in a while and have to do surgical extractions or root canals or replacement therapy. Those things are where the cost is really higher up. And then we look at fear. And I deal with a lot of patients who have anxiety. As myself, I deal with anxiety with dental injection. So anxiety is a big factor. How do we deal with it? I think it starts with the patient communicating to the dentist what their fears are about and sitting down and really discussing those things. The dentist really investing the time and effort. Say, what are your dreams? What are your limitations? What are your goals in your oral health? Where are you trying to reach and what's stopping you? Because if a patient has already sat down on a chair, they've already made that step. All they need is someone to push them further. Because a lot of times where I see the problem with dental fear is patients coming in and sitting on a chair and all these things are bombarded. They don't know what's coming next, what's going to happen. So educating the patient about, today we're going to be doing this, this, and this. Is there any questions that you might have that we can help you along? And then we look at time. Time is very simple in terms of a private practice. We can help our patients by giving them early appointments, Sunday appointments, weekend appointments. But what I look at is time where patients are seeking public health, the public sector. In Trinidad, we have health centers and Mount Hope Dental School, but they don't offer time before 8 and after 4. And I think that is where that limitation needs to be addressed. That's where that problem needs to be addressed. And I hope we can. So moving forward now to our second extreme. Everybody loves cosmetics. Everybody loves that great smile, that perfect smile. How I look at it is cosmetics definitely is there for a reason, and it does boost someone's self-esteem. It does help someone's look and as well their outlook and how things are because of their smile. But what we have to look at is it specific to a patient? It, or is it just for certain ways of how things should look? So when we look at it, we would see that I tend to address it in a way that is specific to certain patients, to patients that are looking for a specific look. And we would sit there, we would talk, we would understand your goals, and from there we can take it to what are the possibilities that are needed to be able to give you that smile. Sometimes it's just one or two teeth, but we can get there with the information that you can give us, whether it's a picture, a past picture, or a picture that you saw that you want things to look like. So I think cosmetics is definitely there for a reason, but it has to be more specific to a patient. And then COVID-19. COVID-19 has been around for 2 years. It's affected us globally, economic, our health, our access to health. But the biggest problems that I see in my clinic is the change in your habits, whether you picked up smoking, drinking, neglecting, hygiene routine, or regular brushing. Sometimes you wake up in the morning and you sit there and you're just Netflixing for 15 hours, watching your favorite show, and you forget about these things. And in the clinic, where does this, how does this show? And it usually will go to patients grinding their teeth, cracked teeth, um, temporomandibular joint problems, which is your TMJ, having muscle pain, headaches, neck pain, anxiety related to acid reflux. So there's a lot of problems that I'm seeing in the dental clinic. But there is also problems that poor oral health leads to a systemic problem. And we can see that, like Don said before, that 3.5 billion people are affected worldwide because of chronic infectious diseases, such as oral disease. And we have to look at diabetes. I believe uncontrolled diabetes is one of the biggest problems that we see. And because of it, we tend to see patients that have poor oral hygiene, uncontrolled diabetes, affecting their gums, affecting their bone, having infections, and then loose teeth. That becomes a problem for a patient because now, because of their poor oral hygiene, because they're losing teeth, they can't eat the proper food, they can't function properly. So that leads to more of a problem in diabetes. And then cardiac problems, such as prosthetic valves, having that increased bacteria in your mouth and infections that can lead to that attachment to that prosthesis and cause problems. There is some correlation to Alzheimer's, dementia. So those things are out there. There is a correlation, but I believe there needs to be more research, more understanding of how it relates to a person or individual in a community. And once we go towards that understanding and probably go into the responsibility of what these causes are, we can sit down and really try to figure out a solution. And I love this quote here. It states that you can't be healthy without good oral health. We need to put more effort and perhaps money where our time is, where our mouth is. And when we look at this, we have to figure out what is our way to execute this change. And we have to look at refocusing the energy on cause rather than symptom. Yes, we are here to help with symptoms. We are here to deal with the symptoms. But we have to understand where that cause is from. What causes these problems? Changing that perception can guide us there. Removing those limitations and barriers can guide us there. And most likely, we can start to recognize the need for education, prevention, and patient acceptance. So let's look at if a patient comes to me in a dental setting. The first thing I would do is understand who my patient is, understand these causes, understand why these things happened, then dealing with the symptoms. I would look at prevention first, teaching the patient that your foundation is so important, just like building a house, just like building a business. You have to build that foundation properly. You have to look over your gum health. You have to take care of the small cavities, then move on to stability. Once you move on to stability and maintenance, then both of us can look at, in 10 years and 20 years, that foundation has gotten us to an oral environment that can keep you healthy, that can function well for you, and that can sustain for a long time. So from there, we would go to what are the ingredients to having proper oral health. And I look at the ingredients as, as food. So I'm a foodie and I love to talk about food when I talk to my patients about the ingredients. It's normal ingredients. Just for example, if you're making like my wife, she makes a great pasta, and if you're making a simple pasta, look at the basic ingredients, which is brushing your teeth, flossing, mouthwash, those normal things. But if you're looking for a great pasta, you really got to take home the key ingredients. And it really starts with taking responsibility, taking that responsibility from a dental aspect and from a patient's point of view as well. From a dentist, we really have to advocate for our patients, to guide them along, to really properly take care of their teeth and properly understand what we're trying to achieve. And from a patient standpoint, they have to advocate for themselves of what they're looking for, what they want, and they have to communicate all their limitations. And then move into not delaying that treatment, maintaining what's there, and making sure that we repeat where we need to repeat to make sure that everything is stable and that you can have really good oral health that is controlled and can give you a great quality of life. So I thank you again for taking the time and effort, and I hope you enjoyed this webinar. I think we're going to open it up to Dawn for any questions. Thank you again.
Thank you so much, Dr. George. Quite a mouthful. So I'm going to hand you over. I'm going to hand you over to Renee Barnett to take you through our Q&A segment. Renee?
Thank you, Dawn. Good morning, everyone, and thank you so much again, Dr. George. So our first comment here that we have is from Tariq, and Tariq has said he's interested in that Hollywood smile. So I'm guessing his question is, how could he get that Hollywood smile?
So like I said before, the Hollywood smile is there. It's just like plastic surgery, everybody's looking for it. But we have to make it specific. So how I usually do it, how I usually start with a smile makeover is you would have a consult with your dentist. You would sit there and the patient has to guide you to what they want. A lot of times you will visit your dentist and you say, Doc, just do what you feel is right. But that's the wrong approach because what I feel is right is for me, that might not be what is for you. So I like patients to come in with their own little presentation of what they think their Hollywood style is. And from there, we can, diagnose and, come up with a way that we're going to move forward to allowing them to have that cosmetic makeover. And it's very simple. The hardest part of it is that communication. So if he is looking for it, I think he just needs to find a dentist that is open to communicate and educate and understand that what they're looking for and guide them in that way.
Okay, great. Thank you so much. Moving on to our next question here. So how important is it really to have open communication with your dentist?
Oh, I think it's very important. I think where it's lacking is dentists do things on a repetitive manner. Every day is fillings, cleanings, extractions, whatever it may be. But sometimes we forget that patients don't do this every day. Even if they did a cleaning 10 years ago, even if they did a cleaning 1 year ago, maybe do it with you. So we have to really figure out how are we going to allow the patients to be open with us. And from there, take the time to really understand what they want. So communication is so important. I think it's one of the top things that everybody should do when they go to their dentist.
Agreed. Thank you so much. Moving on nicely. You mentioned it briefly, but how do you deal with gum disease and diabetes, especially here in the Caribbean?
That's a great question. I mean, diabetes is high in Trinidad and I think the rest of the Caribbean. It has to do with a lot with genetics, maybe diet. We love our stew with sugar. That's how it works. So we tend to eat a lot of foods that affect us. So what we have to look at, how I deal with it is really I start with making sure that patients are controlled. Once you're controlled, so you need to seek out your doctor, make sure you're controlled, make sure you're on the right medication, and then changing your diet. High processed, ultra processed food have to be cut out. And I think the good thing in Trinidad is we do have a lot of good food, a lot of good local source food. So we have to look for that. And then from there, just keeping your appointment, making sure that your dentist is on top of your dental care, that if something does change, because with diabetes and oral health, things change very quickly. So your dentist has to pick it up even faster and stay on top of those things much more than would be a regular patient.
All right, excellent. We have a comment here coming through from Tony Ray, and this leads quite nicely into our next question. So Tony Ray is commenting, she had some anxiety thinking about going to the dentist, but Dr. George is patient and kind. He's a patient and kind dentist, highly recommended. And our next question.
Thank you, Tony.
What is your advice then to a patient with health anxiety?
Anxiety is a big problem, and I deal with anxiety comes from different factors. Sometimes it's not the actual pain of dentistry, but that anxiety itself that builds over time. So the dentist has to be very keen in picking up. And sometimes we tend to talk before we listen, you know? So we really have to sit there and listen to the patient and just let them talk. Dealing with the anxiety is multi, you know, approach. It can be guiding the patient slowly. It can be sedation. It can be nitrous. It can be medication. But to me, I think it's open. It's talking. Everything is about really telling the dentist what your fears are. Because if you already came to the dentist, you're ready to jump that hurdle. It's just your dentist to guide you along. So once they can listen to you and appreciate what you're trying to do, then I think the process is very simple.
Thanks for that. I can very much relate to Tony Ray and the anxiety, but thank you so much for that. On to our next question coming in from an anonymous person. What's the average cost for that smile makeover?
Oh, that's a good question there. Smile makeover. So how you start a smile makeover is simple. You have to first look at what the problems the patient is seeing. What are you looking at that is causing you to say, you know what, my smile? And sometimes smile makeover is not really going to the general dentist. Sometimes it's going to your orthodontist because it's a simple fix. And sometimes there's Sure Smile, there's Invisalign. So those things have helped along. So those can be expensive as well. You're definitely looking in the thousands for sure. But if you're doing full makeover in terms of veneers, crowns, things like that, it definitely could be up there. You know, definitely you can reach over the 30,000 and the 40,000 range. It depends what you want. Some are cheaper, some are more expensive, but it all depends on what you want. Throwing a number at it, like I said, it's so specific to a patient. So throwing a number at it is like guiding you in the wrong direction. I'm just putting another fear. If you're looking for a cosmetic makeover, like I said, go do a consult. It costs you a few hundred, and I think it's worth it to really get the information. So really, what is the cost? Get the information first, go from there, and then the dentist will be able to guide you of where your money can be.
All right, you said a couple hundred, a couple thousand there just now. So I just wanted to clarify the currency for our audience because I know we have persons
TT,
reaching.
yeah, TT.
Okay, so that's TT dollars. Okay, all right, great.
So the hundred is usually consultation fee. The thousands is the initial part of it, and then when you get to the 30,000, 40,000 is usually the cost for delivery. But again, it's
All right, moving on nicely to our question here from Deborah. So she just did a filling and suddenly the tooth has become very sensitive. What would have caused this and how can she get rid of the sensitivity?
right. So this is such a great question. Thank you so much because we have to understand where responsibility comes from. So if you went to the dentist and one, the filling or the cavity that was there was very deep, because we have to know that a tooth is not just stone. It has different parts of it. I look at the outside part of it as a hard substance, an enamel. So if you look at an example as the tree, the bark of it is a hard substance, and inside there's live tissue. That's where water flows. So the tooth inside of it, that's where the blood flows. That's where the nerve endings flow. So they're inside of that too. So sometimes if a cavity is very deep, it's very close to that nerve supply and blood supply. So when a dentist puts the filling there, because it's not it's not an organic substance, it's a man-made substance, it's resin. If you tend to bite down or you drink something cold and hot, it can transmit that to the nerve endings and it can cause that jolt or that pain, as some people would call it. So there has to become the responsibility of a patient knowing that there was a very large cavity and the dentist's responsibility to say, you know what, we can do this but these problems can come about. And then knowing moving forward, if these problems can come about, what are the solutions? Is it waiting? Is it dealing with the pain? Is it taking painkillers for a little bit? Or is it moving forward to a different treatment that can alleviate the pain? So it really comes down to that responsibility, understanding why you're getting that pain. So I hope that helped.
Thanks so much. I hope she was able to get some help there from your response, so thank you. Moving on to another question, another anonymous person. I understand the importance of communication, but I'm not sure how to do so with my dentist. When I go to the doctor, I simply communicate how I am feeling, and he or she takes it from there. How do I effectively communicate with my dentist?
So effective communication starts with, yeah, you're saying what you're fearing. But I think the problem is dentists sometimes will, there's a golden rule, as medical professionals say. You don't do it unto others as you don't want it done to you. But then if a patient comes in with a problem or communicating something to you or fear, and we just go from it, we just attack it in a scientific way, then we're not really taking it to a personal level. We're not taking it to a human level. Because what we might say is we understand, but the patient might not understand. So the patient, again, has to advocate for themselves. I say, you know what, doc, I appreciate all you said, but I have no clue what you said. So again, this is what my problem is. Can you just bring it down to me and really explain it to me in a way that I can understand it? And again, if you don't understand it, ask the dentist to show you diagrams. I show, I love when a patient comes to me, I take a picture of their mouth. I take pictures of things that we can do. I show them, illustrations. Like everybody says, a picture says more than words. So really, pictures and illustrations and things like that can help and guide the patient to. So I hope that helps.
Thank you again. Moving on nicely to our next question. How do we get our children to look at dentistry in a positive manner?
I think we talked about in the webinar. I think that is so important because this is our future, so we have to really look after it. And I think it starts with you as a parent. It starts with you as the adult, putting emphasis on it, getting involved with their dental care, and making sure that they enjoy it. My niece, I remember she doesn't like to brush her teeth, hated it. So, but she loves music. So what I used to do is I'll put on her favorite song and I say, you have to brush your teeth the whole song. Okay. And even now she's an adult. You'll be hearing that song go on for 3 minutes in the morning because everybody will know she's brushing her teeth. So it becomes a habit. It becomes what you encourage. So it's really guiding them there.
Thank you for that one. I definitely need that tip for my 4-year-old son, so thank you. All right, moving on nicely. Another anonymous person asking a question. What can be done by someone who is suffering from bad breath, even though she brushes her teeth regularly and uses mouthwash, Listerine regularly, but within an hour or so still gets a bad mouth odor and a dryness in the mouth?
Right. So that might lead to more maybe a medical reason, or maybe I would take it from a dental reason. Maybe sometimes, we go to the dentist for cleanings, but sometimes patients need something called a deep cleaning, where it's calculus and plaque that is underneath the gum. Because sometimes there's calculus and plaque that is superficial on the teeth, but there's much more to the story. So you really have to make sure that when you go to the dentist, they're taking X-rays, they're really seeing underneath the gum. But from the medical aspect of it, patients that suffer with acid reflux tend to have that. Patients that have certain conditions that maybe affect them. So they really would have to talk to their GP or have the dentist really take an exam and look in their throat and really see what's going on so they can be guided accordingly. So I think if she's having that continuous problem, seek out a dentist that maybe can help you find a solution.
Okay, great. Thanks for that response. Moving on to a comment from Kathleen. Oral hygiene is often overlooked in our health and wellness initiatives. Thanks to Emily and Dr. George for this informative and interesting subject.
Wonderful.
Thanks so much, Kathleen. All right, moving on to our question from Narendra. How do I continue to maintain enamel integrity as a person over 50 years?
Right. So we have to look at enamel as our protective layer, our teeth. So your normal brushing, your flossing, and I believe your diet has a huge factor. Eating the proper food is such an important thing. One of the things that I see in Trinidad that affects enamel is eating a lot of acidic fruit. We love our mango. Fruity mango, starch mango, one of my favorite. And we tend to eat it with our, with our teeth. And that acid, that's abrasion there, continuous abrasion. So we really have to be cautious of how we eat our food and the type of food that we eat. And I think that will allow more long-term protection for your teeth to allow the enamel that's there to stay there.
All right, moving on to our next one. Thank you for that response. How do you get rid of built-up plaque in the teeth?
Oral hygiene at home is great. I think you have to do that. And the proper tools is great. You need to do that. Because going to the dentist, it's great for the checkups, it's great for the cleanings that you get. But if you don't do proper oral hygiene at home, then going twice a year for dental care is not going to really help. So I think it starts with home care. That is the most important.
On to our next one. Can gum disease be reversed?
It depends how severe it is. If it's mild, moderate, even severe, yes, it can be reversed. But once you lose too much bone or the recession is there with the gums, it's going to have its. You are going to eventually maybe lose teeth. So you really have to look at the type of gum disease. Is it genetic or is it due to the lack of brushing and flossing? So we have to look at that. And the dentist has to do those deep cleanings, take care of your mouth, and then from there, the way that you take care of your mouth at home. So can it be reversed? It can be stabilized. Let's just say that.
Okay, interesting. Thank you. We have 2 comments here before I give you our next question. That's a great idea. I'm searching for my teeth stretching song now. And then the next one, the person is saying the webinar is very informative. All right, our next question, dental cavities in pregnancy. Why does this happen?
I think it's just, it has to do with one, maybe acid reflux that a lot of pregnant women will get. It has the loss of nutrition because we're not eating, maybe because we don't like certain foods. And then it has to do with genetics and making sure that you visit your dentist. I think you put we put the importance on overall health of you and the baby, but we forget that, oral health is important too. So you have to really take care of your teeth, visit your dentist every 3 months, making sure that if small cavities come up, that we take care of them. So they usually happen because of the wear and tear that happens during.
Okay, that's an interesting point. Thank you so much. On to our next question. Is dribbling when you sleep indicative of an oral health issue?
Sorry, repeat that.
Is dribbling, or I sometimes say drooling, is drooling when you sleep indicative of an oral health issue?
I think that's just good sleep if you're doing. So I don't think there's anything really there about it. I just think people are in REM sleep a little bit more than others. So good for you.
Okay, thank you. All right, moving on to our next one. My daughter did not lose her baby teeth, but the permanent teeth grew out behind the baby teeth. What do I do?
You have to go to your dentist, and if there's a permanent tooth coming behind a baby tooth, then you have to most likely figure out a way to remove the baby tooth to allow proper eruption of it. Sometimes what happens is because the eruption pattern is not directly behind or underneath the baby tooth, it comes out indirectly into the side. So some of us know the riders, right? And it doesn't allow resorption of the roots of the baby tooth. So it's just stuck there. And so going to your dentist and seeking treatment is probably the best way.
Great, thank you. Moving on to our next one. If you have a missing tooth for many years and the bone is not viable or the bone is not there, what modern suggestions do you have for tooth replacement?
So tooth replacement starts with, dentures, bridge work, implants. I believe now there's stem therapy. We're far from implementing it. There has been some trials of success. So everything is patient specific. If there isn't enough bone, to do an implant, there is treatment that you can use synthetic bone to be able to build that area to get an implant, such things as sinus lifts or splitting the bone. So there's a lot of treatment out there that can deal with those problems. And so don't be scared that maybe you are not going to be able to get a treatment because your bone has receded or you think it might not work. You just got to find the right dentist that can approach it in a way that's specific to you and show you the possibilities that are out there to give you that treatment that you want.
Alrighty, excellent. Moving on to our next question. What are you seeing relating to dental practice since the pandemic? Are you finding that there is a major fall off in the visits? What is being done to educate persons that they can still come out, even though it's a pandemic?
So during the pandemic, a lot of dental clinics were not opening up to general treatment or checkups. And I think we're now starting to get back into it. So getting appointments now is much easier. Before it was a bit hard. So we have to make sure that if your dentist is recalling you and you're seeing the dentist continuously, it's great. But if you're not, again, you have to advocate for yourself. Pick up the phone and say, hey, you haven't called me for a while. I want to come see the dentist. And then in regards to education, I believe that the dental community goes out there as much as possible to do screenings for different communities to be able to educate the population. But we have to really, like I said in my webinar at the end, is we have to look at the key ingredients. We have to take responsibility from ourselves to really find the right information for us and find the right venue that we can get everything that we need. So I think it's out there. It's just sometimes implementing it is the hard part. Reach everybody because sometimes you'll see the major hubs like Port of Spain, Central, South. They're getting all these dentists are visiting them, but there's these other areas that maybe we're not going, and you'll see health centers in certain areas, but not in these areas. So we really have to start changing that to be able to provide oral health and education for the entire population, entire country.
Alrighty, thanks so much, Dr. George. So we're out of questions at this point, but I'll just give you the floor to give us any key takeaways before we hand back over to Don.
The key takeaway is really it comes down to your oral health or your overall health is really in your hands. And what you do matters. Where you go to receive that treatment matters. So make sure that when you do go and receive treatment or you access dental care, that it makes sense for you. So you really have to, again, know what you're getting into and understand why it's so important to see this dental treatment and just move forward from there. And I hope that everybody can find the right dentist that can openly communicate with them, really understand their dreams about and their goals about dental care.
All right, excellent. Thank you so much. I hand you over back now to Dawn. Dawn, over to you.
Well, thank you, Renee. Thank you, Dr. George. I don't have any more funny anecdotes, but Dr. George, I want to thank you for being here. We've been seeing people singing your praises in the comments. So I wanted to thank you, especially for sharing this very timely information. And I can't stress enough the fact that with the pandemic, we've been locked down for about 2+ years now. And we would have heard that persons were not really self-caring because nobody really wants to go outside. So I want to thank you all for, I know that you answered a question along that line. And I really want to impress on our audience here that we need to find a way to look after ourselves, look after our oral care, and therefore understand what is happening within our bodies by going to our doctors, finding a safe way to keep up with the regime of keeping healthy. And I think that is really important. And I want to thank you, Dr. George, for impressing upon us all of the things that could go wrong if we do not follow the signals that are given in our mouth. I particularly liked the you mentioned that as us, the adults, our habits become the habits of our children and the younger relatives, and that we must pay attention. And that really stood out in this presentation. So, and I know, to Renee's point, having that song for your younger relatives that they can, learn to brush and understand that brushes, that's not just making a circle and coming back out. So I want to thank you so much for being here, for sharing this information. And I hope that many people, any other questions that they have, they'll reach out so that we can get them to you and share. So thank you, thank you, thank you. And to everyone on the call today, I want to say, well, thanks for sharing with us. Thanks for joining us today. I want you to remember to look out for our flyers announcing our upcoming webinars and our paid programs. We have conversational intelligence, and that is, I believe that we all should understand that we are not just talking. So look out for conversational intelligence coming up in June, as well as one of our signature programs, Expectations of a Massy Leader. If you've done it before and it's been past 2 years, remember it's time to have a refreshers. So feel free to speak to your manager, your HR department, and sign up for our programs. So until next time, I want you to remember, continue to level up and continue to look for us here in this space. So bye for now and take care.